Hello everyone. We have studied two primary cerebral injury, cerebral concussions and cerebral contusion. Today, we will study the third one, diffuse axonal injury, DAI for short. First, let's review the causes of cerebral injury. Such causes include traffic accident, fall, tumble, and fight. So, do all these injuries cause DAI in patients? To answer this question, we should know about its concept first. DAI is a kind of injury characterized by extensive of diffuse axonal under the violence of rotation acceleration injury. This concept involved two main points. The first is the violence mechanism. The patient is subjected to a rotation acceleration injury. What is rotation acceleration injury? For example, when a patient rolls down a staircase, rolling is a kind of rotation, and the patient shows acceleration during rolling. The second is the neuronal structure, axon. The axon is also called neuride. Next, let's learn about the pathologic changes. From the concept, it can be seen that the injury structure of the AI is axon. Therefore, it can be deduced that the site of the injury is the area where the axon gather. In the intracranial region, the axon aggregation region are mainly the gray-white matter junction regions, callosum, basal ganglion region, brainstem, and the cerebellum. This is a functional magnetic resonance image of the head with diffusion tensor image applied. It shows the fibrous bundles in the brain tissue, which are formed by axons. With naked eyes, we can see tissue crevices and blood vessel bleeding. Under the microscope, we can find axonal and axoplasm overflow, and that axonal retraction balls are formed. Clinical manifestation of DAI include three elements: symptom, sign, and imaging examination. First, let's learn about the symptoms. The most obvious manifestation of DAI is immediate coma after the injury. This coma is featured by high degree, generally above coma in moderate depth, and long time, generally more than 6 hours. A few patients with minor injury may have a lucid interval. Patients with serious injuries are in a vegetative stage or die. In terms of signs, eye signs may occur due to injuries to the brain stem. Such signs include changes of pupil and eye movement. And unilateral or bilateral dilation may appear in the pupil. Movement may appear as abnormal deviation or gaze, or even dislocation of movement. However, these manifestations are not specific. Therefore, the patients with DAI do not show obvious localization signs of nervous system. In terms of CT, DAI manifestation can be summarized into three aspects: injury site, direct site, and indirect site. The injured site are the axon aggregation regions, including gray-white matter junction region, callosum, basal ganglion region, brainstem, and the cerebellum. This complies with the pathologic changes. The direct signs are single or multiple small hemorrhagic focus with no mass effect, and some small white spots in the lower right figure are small hemorrhagic focuses. In addition, the indirect signs of diffuse cerebral swelling and subarachnoid hemorrhage are also included. Among them, one important thing is that there is no midline shift. After above study, we can diagnose the DAI according to the following ideas. Firstly, A patient with a history of rotation acceleration injury become coma immediately after the injury. Deep coma with a long time. Some patients may show eye signs. So we can make a preliminary diagnosis. In clinical practice, we often need to combine images to get a more definitive diagnosis and treatment. DAI treatment include general treatment, non-surgical treatment, and surgical treatment. General treatment involves observation, dynamic CT review, and respiratory tract care. Non-surgical treatment is mainly performed around controlling intracranial pressure and improving brain function, including low-temperature therapy, hormones, dehydration, and calcium antagonists. Surgical treatment is mainly performed when the patient's conditions worsen, including aggravation of intracranial hematoma and cerebral swelling. The specific surgical methods include hematoma aspiration and decompressive craniectomy. The prognosis of DAI is often poor, which is characterized by high fatality rate and disability rate. In the early age, most of the patients die due to brain stem failure, and in the long term, more of the patients die due to the complications. Some patients are in the vegetative state for a long time, bringing a heavy burden to their families. As medical workers, we should offer more care to the families. Next, we will conclude this lesson. We have compared the three primary cerebral injuries: cerebral concussions, cerebral contusion, and DAI. When DAI is compared with the former two, its consciousness disorder is featured by the immediate appearance after the injury, high degree, and long time. By physical examination, there are no obvious signs of localization. In terms of imaging, the CT findings of DAI shows the formation of multiple smalling hematoma with no mass effect and no midline shift. That's all for today's class. Thanks.